Momanyi, KTN News, Lamu County.
Thank you, Sharon. I would really love to experience that boat ride, one of its kind. But to matters health now. After carrying a pregnancy for 9 months, women have one of two options, either to have a normal delivery or a Caesarian section delivery for their baby. Now, as Dr. Korir reports, as much as the government offers free maternity, there is a cost to it that you, the taxpayer, foots in public facilities or your private insurer settles in private facilities. On your health budget, find out how much you pay for a Caesarian section delivery.
Many things have been rapidly changing in the Kenyan health system, including a concerning increase in the number of Caesarian sections for deliveries.
The average Caesarian rate for a country or a hospital should be between 10 to 15%, but in our country we are seeing a 50% Caesarian section rate. Something that comes with not just the risk due to the surgical procedure, but a high financial ask. First, a Caesarian section will need several personnel with different qualifications. Now, depending on the level of qualification of these people, it affects the cost. So, for example, if the Caesarian section is being done by a consultant like myself, it is not going to be the same cost as a Caesarian section being done by a medical officer, for example. How much do you think a delivery by Caesarian section costs?
If they say it is like 2,000, it is very much okay.
I say 5,000.
FOC, free of charge. Public should be around not more than 20k. Maybe for private should be around 50k.
Public sector, I think it should be free.
I guess should be 50,000.
5,000, I believe, is affordable for such a service, considering the cost of living.
A cross-section of hospitals in Kenya will have varying charges, and these are the average costs. At the Aga Khan University Hospital in Mombasa, an emergency Caesarian section will be an average of 210,000 Kenyan shillings, and a planned elective will cost a similar amount. At Medihill Hospital in Eldoret, an emergency Caesarian section will cost between 180 to 200,000 Kenya shillings, and a planned elective will cost the same. At the Nairobi West Hospital, this emergency Caesarian section will cost approximately 180 to 230,000 Kenya shillings, with an elective Caesarian section costing the same. At the MP Shah Hospital, an elective Caesarian section will cost an average of 220,000 Kenya shillings. At public hospitals covered by the National Hospital Insurance Fund, NHIF, this will be 30,000 shillings for both an emergency and an elective Caesarian section. Of course, by the time they have priced the surgery at 220, they have made their profit. Medicines and other consumables like gowns, sets, gloves are all charged for a Caesarian delivery. And unfortunately, in this country, we have a very high import rate. So you'll find that up to 90% of these consumables are imported. And not just that, the time spent in the operating room is billed in private facilities. Usually, theatre time is charged per minute. Yeah, so you find that the longer the operation takes, the more the theatre time is, and that is billed, yeah, to the patient. And then the other things like oxygen that the patient receives, and they have to pay for it. Public health facilities tend to be cheaper because of the government. The human resource is not paid for by the hospital. It's paid for by the county government or by the national government, So there is subsidy on labor. That cost is waived from the patient. In private practice, unfortunately, they have to buy everything. While public facilities offer the bare minimum, extras in private facilities drive the costs up. Especially in the big hospitals. Delivery has become more of hospitality than just a medical care. So I walk into a facility, I want to have fancy things that don't necessarily add to my medical care. And for the hospital to provide that, then it comes at an extra cost. While it is everyone's wish to get the best quality of care, question is, are some costs warranted to add to your health budget? Dr. Korir, KTN News.